Welcome to Connected by Health. I'm Dr. Krishna. This is where medicine meets leadership, innovation, and humanity with one goal: to add value and help change healthcare for the better. If you believe health is about more than a diagnosis, you're in the right place. Before we begin, a quick note for listeners. This episode discusses healthcare costs, insurance, and systemic issues that affect people very personally. We'll talk about money, access, and the structure of the healthcare system. If you've ever felt stress, frustration, or confusion when dealing with medical bills or insurance, you're not alone. This episode is for education and discussion matters only. It is by no means financial, legal, or medical advice. So, this is the question that everybody asks, but we don't really ever get an answer to it. Why does healthcare keep getting more expensive? It's the question patients ask at the pharmacy counter. It's the question families ask when they open a hospital bill. It's the question that employers ask every year when insurance premiums keep rising again and again. And it's the question, let's face it, that policymakers and lawmakers ask, often without agreeing on the answer or finding a solution to this problem. But to understand the scale of this problem, we need to start with this number, and it is mind-blowing. But the United States healthcare industry is now worth up to $5 trillion. So the United States spends $5 trillion and more a year on healthcare alone. That is the third biggest economy in the world if it were to be an economy by itself. That's more than 18% of the entire US economy. And that means nearly 1 out of every $5 in this country goes to healthcare. And this is the other problem, which despite spending this much, despite all the trouble that we all have in trying to understand why a test costs this much, despite everything, and despite the fact that millions of people still delay care, skip medications, or struggle to afford basic services, we're spending so much, it just does not make sense. And so today, we're going to talk about and ask ourselves a harder question. Why does spending keep going up, but why doesn't it feel like we're ever getting any proportional value in return? So, what do we mean by healthcare costs? We have to first define that for ourselves before we move forward. When we talk about healthcare costs, we're often talking about very different things. There's what the patients pay out of pocket, which is premiums, deductibles, copays, and coinsurance. And then there's what the employers pay to cover workers. Then there's what the government pays through a series of different federal government programs, such as Medicare. Medicare, remember, is for everyone that is 65 years or older, and also for the disabled, and also for patients on that have end-stage renal disease on dialysis. Medicaid is also another government payment program that is often based on your salary, and it also does cover a significant, if not all, a portion of childcare in the United States. And of course, a couple of other public health programs such as CHIP, the Indian Health Service, the VA, we can go on. But then there's total national health spending, the actual cost of delivering care. And in recent years, the national health spending has grown around 7% annually. And here's the other problem. That is consistently outpacing inflation and wage growth, meaning we're spending more every year, but that is not meeting up with our wages, the amount of money that we're getting, our income. And that disconnect is very important. See, wages have risen slowly, but unfortunately for us, healthcare costs have not. And this is one of the main reasons why healthcare feels increasingly unaffordable, even for people that have health insurance. So next, Let's look at something else, which is insurance premiums and cost shifting. Employer sponsored insurance remains the most common form of coverage in the United States, even despite all the chaos that we've had over the last 2 decades. Employment sponsored insurance still remains the most common form of coverage. But here is the reality: the average annual premium for a family plan now is close to $27,000. That's for 1 year, an employer is spending nearly $27,000 covering a family of one of its employees. And so employers now pay much of that, but the issue is workers also feel it through their paycheck, through deductions, with higher deductibles, and with cost sharing. So since the year 2000, family insurance premiums have also increased by nearly, get this, 300%. And I repeat, 300%. So during that same time period, wages, however, increased by less than half of that amount. So there is the problem. And in order to control spending, insurers rely heavily on deductibles. So today, about 1/3 of all insured workers face deductibles of nearly $2,000 or more before coverage truly kicks in. This doesn't reduce healthcare prices by any chance. Instead, it shifts costs onto patients, onto us. And when patients delay care because of cost, conditions worsen. They often lead to higher costs later. And that's the reason why prevention, if we want to talk about healthcare reform, which we have in other episodes of this podcast, prevention is key. Emphasizing prevention and primary care are both important because they can lead to earlier diagnosis, which can lead to much more manageable treatment compared to later diagnosis, worsening conditions, higher cost because of expensive treatments. So, when patients delay care because of cost, the conditions worsen and higher costs are caused. We also need to look at another aspect of the healthcare industry that has really grown, whether if that is to the detriment or to the benefit, I will let you all decide. But that is the aspect of hospitals and consolidations, and also pricing power. So remember, hospitals are one of the largest drivers of healthcare spending, right? And over the past 2 decades, hospital consolidation has significantly accelerated. In many regions, usually one or two health systems dominate the market. And so when you have competition that is decreased, prices rise. And so research has consistently shown that hospital prices, not utilization, are a major reason why US healthcare spending is higher than in other countries. But also, we cannot forget hospitals do face real financial pressure. Labor accounts for roughly 55 to 60% of all hospital operating costs. 55 to 60% of hospital operating costs go to labor alone. And then here's the other kicker: nursing shortages have really driven wages up significantly, especially for those that are contract and travel nursing staff. Hospitals also have to absorb a significant large underpayment for Medicare and Medicaid, amounting to well over $100 billion per year, which hospitals often attempt to offset through higher commercial prices. So this combined dynamic of hospital consolidation, higher prices, staffing shortages, and of course, decreased payments and reimbursements from the government funded payers, all of this really pushes premiums and patient costs higher across the system. Next, we also need to look into another important aspect, which is a pretty big one. And we hope to cover this in other episodes too pretty soon. But for prescription drugs and specialty medications. Because prescription drugs are another major cost driver, particularly when we speak about specialty medications. In recent years, the median launch price of a new specialty drug exceeded about $300,000 per year. Now, unfortunately, these drugs can be life-changing or even life-saving, but that doesn't matter apparently. Their costs now ripple throughout the system, and they do that by raising insurance premiums, by increasing cost sharing, and by straining public budgets. So, the US pharmaceutical market really involves manufacturers, pharmacy benefit managers, insurers, pharmacies, and employers. And when you have these many role players, each adds a certain level of complexity. And complexity thereby leads to more cost. And this is a very difficult mm, part of healthcare that is to look at because of the many different role players that have come to define a prescription drug cost in this country. In addition, we also need to look at something else, which is administrative complexity and, of course, overhead costs. The issue is this is one of the most least visible but most expensive driver of healthcare costs. And administration is becoming at times also a huge balloon that is just ready to pop, but also not really being addressed appropriately. And when you're looking at administration, you're not just talking about costs of CEO salaries or overhead costs, as in the cost of a building or the desktops, and of course the software. There's a whole consortium of issues that come with administration. Whether if you're looking at billing, whether if you're looking at coding, at prior authorization, compliance reporting, contracting. Studies estimate that administrative costs account for roughly 25 to 30% of all US healthcare spending. 25 to 30% of all spending. That is a lot. That's hundreds of billions of dollars each year. Clinicians spend hours documenting care to satisfy the billing and the regulatory requirements, and I, once again, know that from personal experience. Health systems hire literally entire departments just to manage insurance interactions. There are prior authorizations related staff. There are compliance staff. There are staff that are dedicated to contract negotiations, whether that is for employees or whether that is with the payers. And the problem is a lot of this work doesn't really improve outcomes. It really doesn't impact necessarily the final outcome of patient care. Instead, it just raises costs. And that is a really sad aspect of administrative costs. It is not something that will come to really define patient quality and safety, but rather just increasing costs. We also have to look at workforce costs and shortages, and also look at workforce burnout, which has tremendously increased after and during and after the COVID-19 pandemic. Because you see, my friends, healthcare is fundamentally a people-powered industry. Workforce shortages, especially among nurses and primary care clinicians, they drive costs up tremendously. And when you have these workforce shortages, when you have incorporated increased administrative costs and burdens for clinicians, specifically with documenting and adhering to all the various regulatory rules that they have, this leads to burnout. And when you have burnout, you lead to turnover. And what a lot of people don't understand is when you have staff turnover, whether that is nursing, whether that is clinicians, turnover increases recruitment, training, and temporary staffing costs. Travel nurses and contract clinicians can cost hospitals nearly 2 to 3 times more than permanent staff. That is 2 to 3 times more than permanent staff. So there is an incentive for hospital systems to recruit and to retain. But the problem is when we underinvest in workforce well-being, the financial consequences appear everywhere. It's not just a matter of simply continuing to ignore burnout. We have to do more about addressing that issue because it all is connected. And when we invest in our workforce, when we invest in programs that help reduce burnout, you will see further downstream improvement, not just in staff retainment, but also in patient outcomes. Over the last couple of years, we in the United States have really had this increased emphasis on chronic disease and preventable illnesses, specifically more in the chronic disease management. Because, my friends, today, nearly 6 in 10 US adults, almost 60%, live at least with one chronic condition. Now, what kind of chronic conditions are we talking about? Well, these are the bread and butter that we typically see these days. high blood pressure, hypertension, high cholesterol, diabetes, usually type 2 diabetes, congestive heart failure, COPD because of the prevalence of smoking, even simple, what may be simple illnesses, but actually end up being high acute cost care illnesses, specifically mental health, which is something that we don't really even look at. But mental health is a significant contributor to costs because of the impact the mental health can have eventually on an individual's physical health. But chronic diseases account nowadays for the majority of healthcare spending. And many of these conditions, unfortunately, are preventable. We just have to catch them earlier. And they're manageable, of course, with early intervention. But here's the other catch. And we don't often talk about this, but we should. Prevention is significantly underfunded in the United States. Public health and prevention account for less than 5% of total health spending. We spend nearly 25 to 30% on administration, but we spend less than 5% on prevention and public health. We spend far more treating advanced disease, to be honest, rather than preventing it. Does that make sense? It doesn't make any sense at all. We need to do a better job of investing in public health, of investing in prevention. Because remember, when you catch something earlier, you're able to treat it a lot quicker. You're able to treat it at a much more efficient means, and you're able to avoid the advanced treatment that is often more costly. Of course, everyone also, in addition to looking at public health prevention, I think everyone instead is more focused on the advent or the rise of AI and other forms of technology. Now, the issue with this is there's promise and there's costs associated with technology. Technology is not cheap. Keeping yourself updated is not cheap. You have to see it as an investment and you have to do it efficiently and you have to do it smartly, where you don't want to unnecessarily, should I say, just buy and keep upgrading yourself every time. You can't keep doing that because healthcare technology can improve care, but it also increases cost when not aligned with value. Advanced imaging, digital platforms, AI tools, new devices, these are great. They're really exciting. But the problem that no one really looks at is how often they add expense without really replacing older processes. Technology can save money when it eliminates duplication, but not when it stacks on top of existence. We need to invest in technology in a smart, efficient way, but not necessarily just in a way that doesn't increase efficiency. We also need to look at, in addition to technology, we also need to look at policy, payment models, and incentives. Healthcare costs reflect policy choices. The problem is that the most dominant payment model, which is the fee-for-service model, rewards volume. It doesn't reward value. Because value-based care aims to reward outcomes. But the issue with value-based care is that adoption of value-based care remains so uneven. Some of you may not even heard of value-based care, and we have episodes dedicated to helping you understand that. So please make sure to listen to those too. But the problem is a lot of public programs face budget constraints. So there's less of an incentive to adopt value-based care. And remember, the private markets prioritize negotiation power. They don't necessarily prioritize outcomes. They prioritize negotiation power. No single policy will ever really have caused rising costs. No single policy will fix them. So why does this feel personal? Why does this feel so much of an issue that it is affecting all of us? Because healthcare costs just don't rise in a vacuum. Because it affects everyone. Nearly 60%, surveys have shown that nearly 60% of Americans report having delaying or skipping care because of cost. I didn't think that number was going to be that high. That is incredibly, incredibly higher than I thought what it would be. And here's another stat that will kind of blow your mind. Another estimate suggests that over 90 million people, 90 million, almost close to a third of this country, struggle to afford quality health care. We're supposed to be the wealthiest nation in the world, and yet nearly a third of our country struggles to afford quality care. And now these aren't just numbers, abstract numbers I'm just throwing around. They represent a whole series of issues. They represent fear. They represent stress, whether that is physical stress or financial stress or even mental stress. And they also represent trade-offs. There's always barriers to reform. There's always barriers to changing things for the better because, remember, fee-for-service is focused on increasing volume. And when certain role players are making more money using a system that exists, there's less of an incentive for them to uh, get on the bandwagon of reform and change. And that's a problem. So what can we actually change then? See, healthcare costs keep rising because the system is doing what it was always designed to do. That's the problem. And if we really want different outcomes, we need different incentives. That means we need to invest in prevention, whether if that is vaccinations, whether if that is screenings, specifically such as screening for cancer, screening for diabetes, screening for high cholesterol, and also screening for cardiac disease. Those are all measures that can help lower costs. But it also means that we have to look into simplifying administration. If 25 to 30% of our healthcare costs is going towards billing and prior authorization and compliance reports, we just can't keep surviving in a system where you're spending that much on an aspect of the system that doesn't really influence patient or health outcomes. We also need to invest in supporting the workforce. We need to look at emphasizing and addressing clinician and other ancillary staff well-being. And we need to look at perhaps reforming the way that we train. We also need to provide incentives to help reduce the financial stress associated with that training. These are very important measures to take in order to ensure a strong and efficient workforce. Because labor, despite the advent of technology, is the mainstay to run the healthcare system. AI is not there yet. AI is not going to go check your blood pressure. And even if it is, how accurate is that? AI is not going to go in and put in a stent. We're not there yet. Maybe we will be down the road. Who knows? But we need to have the physical workforce ready to go, well supported, and of course, well paid. Another aspect that we need to look at and continuing to invest in is aligning payment with value. Value-based care is a tremendous idea, an idea that I think really can make a significant impact on addressing this question that we're asking ourselves. But the problem is adoption of it is so uneven that we cannot continue to ignore it as an option. Healthcare is expensive, my friends, but more importantly, it's personal. And until we treat it that way, the cost will keep rising. So now the US healthcare system is facing two related problems: a looming physician shortage and also structural barriers in how we train those physicians. And so there's a great degree of variability about how we go about doing that. And that is something that we have to address. And that is a question that we've asked in another episode. But that is also key to look at when it comes to asking ourselves, why do healthcare costs keep going up? If you have been listening to this episode, we thank you. We do want you to share this episode with your friends, your colleagues, or a policymaker. We need your help. Medicine needs your humanity. We can address this question and we can change the system for the better. Thank you. If you found this conversation valuable, share it with someone who could use it. And if you're on Apple, we'd love to hear your favorite takeaway and a review. See you next week.